Spotlighting Hawaii's leaders.
We want to bring in Governor David E.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yanji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Longstrugs and Beachside Roofing.
Aloha and good morning. Thanks so much for tuning in with us on this Monday morning. I'm Ryan Kalei Suji, joined by Yanji Denise. Great to see so many of you starting your week off with us this morning. We were scheduled to have Governor Ige appearing on our show today. However, there was a scheduling conflict and the governor, unfortunately, is not able to be on our program today. But we have someone else who always spurs a lot of conversation and discussion on the topic of COVID-19 here with us this morning, Yanji.
That's right. We have the expert of experts, and that is Dr. Tim Brown, infectious disease expert, who, of course, is a fellow at the East West Center right here in Honolulu. Dr. Brown, thank you so much for joining us this morning. As we come on the air right now, 833 cases reported today. The case count consistently going down. How are you feeling about where we are right now?
Good morning. Good morning to your viewers. I think we're in a fairly good position right now. I think the fact that Omicron did turn out to be less severe than the previous variants had been in terms of fatalities and hospitalizations has worked out in our favor. I think that lower severity combined with the fact that our vaccinations have been so effective, I think in terms of reducing people's vulnerability to the virus and their susceptibility to severe illness and death, those two factors combined, I think, have really helped us basically to bring this down much more quickly and to not see as much effect. Although with that said, I want to stress that I said less severe. I didn't say mild. I think there's a tendency to describe Omicron as mild. I don't think that it's actually mild at all. In fact, if we look at those who are not vaccinated, Omicron causes just about as much severe disease as the original variants did. So it still hospitalizes people, it still kills people. And so it is mild only in those people who have been vaccinated and even more so in those who have been boosted. So I think that it's really the vaccinations and the boosters that have saved us here, not so much a lower severity associated with the virus itself. It's really important to remember we've got 2,500 Americans dying every day now, 120,000 in the hospital and 22,000 in intensive care units right now. And that is all largely due to Omicron. So for those people, it is definitely not mild. It's a very, very severe illness that is causing as much damage as we saw previously. I do want to stress that I think we dodged a bullet here in Hawaii because of our higher vaccination rates. This could have been much worse if the severity of Omicron had turned out to be more serious than we thought it was originally. We really didn't know in the first weeks when the decisions were being made to really not start restricting gatherings, not cut back on the transmission. And it could have been much worse had that not turned out to be the case. So I think that, we really got lucky in this case. And had it turned out to be more severe, we probably would have exceeded our hospital capacity. Again, we ran very, very close to the fine, hairy edge here. And so I do think in the future, I hope that we, hope for the best, but then really prepare for the worst, make an assumption that it may be more serious than we think it may be at that point in time until we actually know and base our policies on that.
I think there was also just a general consensus going out there in the community and public at large throughout just beyond Hawaii that once we kind of get through this Omicron and once we bring those numbers back down, that we will be in a much better place and that we are seeing the end of this 2-year, 3-year nightmare that we've all lived through. What are your thoughts about where we go to after this, moving forward, once Omicron maybe makes its way through this community? What are some other things that are concerning, or do you think that we are in a better position moving forward?
I've got a number of concerns, but at the same time, I think in some ways we're better prepared. In other ways, I think we're not. Where we're going to settle on this, My suspicion is we'll probably end up settling in at maybe a couple hundred cases a day, if not a little bit higher than that. I think it's important to remember that with the original variants, we had settled down to about 40 to 50 cases a day statewide. After Delta, which was more contagious than those previous variants, we settled in at about 100 cases a day. And Omicron, again, is even more contagious than Delta was. So again, we may settle in at a somewhat higher level. Now, that means there will still be a substantial amount of virus out in the community, which means if people totally drop their guard, we could start to see some surges again, hopefully not as large as what we've just seen. Hopefully some of the immunity that's been gathered with this latest surge and the fact that it improves the response of those who are vaccinated from an infection with Omicron will hopefully lead to, smaller surges in the future going forward. But I think we've still got to be cautious. And as we let down our precautions, we need to do it gradually and monitor carefully what's going to happen. In terms of where the virus is likely to go, I'm not one of those who subscribes to this after Omicron, it's over. We said the same thing after Alpha. We said the same thing after Delta. We're saying the same thing now. But it's really up to the virus to determine where things go from here. And I want to stress at this point that only 60% of the world is vaccinated. There's 40% of the world out there, unvaccinated people who basically, many of whom have not yet been infected. And so there could be a breeding ground really for new variants among those people and also among the largely, 35% unvaccinated here in the United States. We've still got a substantial unvaccinated population. So the possibility of future variants is very real. And what I want to stress is future variants will not necessarily be milder. Okay, there is what I really consider a fiction out there right now, that after Omicron, everything is going to be a much, much milder infection. That wasn't true with Delta. Delta, in fact, was worse than the previous variants before it. Omicron kind of leapfrogged over all those other variants because of its transmissibility, but fortunately was less severe. But we don't know what the next one will be. It may be a little less infectious, but more severe. It may be more infectious, but less severe. And I think until we actually see what's coming down the pike, we're really not going to know on that. So I think we need to keep our guard up. We need to have a society that is prepared to respond if another variant comes along. And I think that's really what's necessary. We need a vigilant society moving forward that's ready to deal with it.
When you talk about a vigilant society, I think there is a perception, or at least a feeling in the community that because Omicron has presented, as you noted, more mild in people, especially those who've been vaccinated, that if I catch this, it's not nearly as big a deal as I thought it once was. We have tools to deal with this. This is part of what people call living with COVID. How do you respond to that?
Well, I think with Omicron, that's been true to some extent because it was mild enough. And we know the cause of that. Basically, it's because it tends to infect the upper airways more so than the lungs, whereas the previous variants would establish themselves in the lungs, which is where they did more damage. But again, we don't know where the next variant will come in on that. So I think, there's really a number of things that we need to be doing as a society to prepare for that. I think one is we need a good surveillance system, a system basically that really tracks this going on. And our dependence on caseloads right now is problematic, especially given our testing capacity limits and the other problems that we've seen in the last month. So we really need to, I think, enhance our influenza and pneumonia surveillance to get larger samples and basically give us a better idea of exactly what the trends in the community are. We know that in the last month, we lost track of the trends because of changes in testing, the increase in testing before Christmas and New Year's, the shortage of tests that became obvious, the long lines that occurred after that period when, a lot of people probably stopped testing, the increased accessibility of home tests that basically made it easier for people to just test at home and not go into any of the sites that would get recorded. And so we probably missed a whole lot of cases that became positive through home test. And so I think that doesn't get in our system. So we really need to establish a surveillance system going forward that allows us to track this and then gets the information out to the public about what's going on. I think we need to prepare people to use better quality masks when there are future surges. And I think that, part of that would be the government, both the state and county governments, as well as the federal government. I think stockpiling higher quality N95, KN95 masks and having those available for people immediately if we start to see a resurgence within the community. We also clearly need expanded testing capacity. Okay, and that includes a lot of home testing, because I think, home testing is really kind of the wave of the future, because the home test, the rapid tests, look more for infectiousness. They do just for the presence of the virus. PCR will catch infections before you're infectious and after you're infectious, and you'll still test PCR positive. With the rapid test, you largely catch people when they're infectious, when they can transmit to other people. And so rapid testing really, I think, has a critical prevention role going forward in identifying when people need to isolate and also when they can come out of isolation. I think the current quarantine requirement of only 5 days and no test to end isolation is a mistake. There should absolutely be a 2-test requirement, 2 rapid tests in succession, 24 hours apart, before people come out of isolation. And there are studies that have shown that, in fact, that's absolutely essential, that almost 50% of people were still infectious on day 5. So I think there's a real issue there. I think we need to work on our treatment. Right now, we talk about the treatments, but the reality is the treatments aren't available right now. The 2 treatments that work against Omicron are Paxlovid, which is a set of pills that you take, and sotrovimab, which is a monoclonal antibody that has to be infused. But those are in very, very short supply right now. So we're very lucky that Omicron did not cause a lot more severe illness than it did, because we don't have access to those treatments. And in fact, our supplies are not really going to be ramping up on those until May or June timeframe. That's when the U.S. will finally get a lot of the supplies that it's actually ordered of those drugs. So I think that, we need to be cautious in that interim period, because the treatments are going to be of limited availability. Now, doctors and nurses are much better at treating COVID now, even without those, so they can deal with the symptoms more readily. They basically can help people survive through it. But at the same time, the kind of miracle drugs that we're anticipating are further down the road than what we have right now. And they will also require that as soon as you test, you get onto the drugs. They have to be taken in the first 5 days of illness. And so if we do not have access to them, or if our treatment system is delayed, for example, some of these places now take 5 days to get a result back to somebody, then it's too late. Those drugs will no longer be effective at that point. So we need to improve our testing system and do away with these places that are taking 4 and 5 days to get results back to people. Every result should be back within 24 hours maximum. So I think, those are some of the things we need to do going forward to make sure that we're ready to deal with the next surge.
One of the things that you mentioned is that surveillance testing, and we're getting a lot of questions here about positivity rates. Of course, we know that the Department of Health no longer provides that data because they say that they're overloaded. How do you think that we are able to assess where the virus is in our community, its prevalency, and this overall rate without a key metrics like positivity rate? And, what are your thoughts on where we stand right now without getting that information from the state?
Well, I think they are doing some sort of proxy positivity rate. I don't know the exact method they're using. Although looking at the webpage, it looks like what they're doing is they're taking the positive cases in the last week and counting those, basically assessing positives and negatives for the last week and using that to develop a proxy rate, rather than using the entire, time frame over that period. Now, whether they're sampling to do that or whether they're actually using all the cases, I do not know. You'd have to ask the Department of Health. That positivity rate does seem to show we're about halfway down from the peak. We peaked at above 20%. We're now down I think we're hit 9.1 today or something. So we're down about halfway from where the peak was in terms of positivity rate. Now, I think our caseloads may have dropped much more rapidly because a lot of people stopped testing so much after Christmas and New Year's, and also because a lot more people are using home test kits now. So the caseloads may be dropping artificially fast, whereas that positivity rate would imply we're about halfway down from the peak at this point. So I think, setting up a good surveillance system will be a necessary step moving forward so that we don't run into these kind of difficulties in reporting things out to people, so that we have a systematic, regular system that collects this information and reports it out that doesn't require as much human intervention as what I think the current system is absolutely requiring, which is why we've had so many problems.
Christine Donnelly writes the Kokua column, and following up to what you had just said, she says, regarding surveillance systems, wastewater testing is one possibility. Could you please talk a little bit more about that option? We'd heard that early on in the pandemic, and then I had read recently that that was something that was being considered, working in partnership with the University of Hawaii. Is that something that's being looked at here in Hawaii, as far as you know? And is that something that you think is an effective way to do that, to bypass all the issues that you just discussed with case counts and positivity rates there?
Well, I don't see it as replacing. It may replace case counts and positivity rates, but it won't replace things such as a systematic surveillance system that can actually give us an estimate of the cross-sectional prevalence and the positivity rate in the population. I think we still need that part of the system. But wastewater is a very important early warning part of the system, because wastewater surveillance can pick up COVID long before it actually starts showing up in the caseloads and in the hospitals. Okay, because it basically people pass COVID through their waste. And when you pick it up in the wastewater systems, you're basically getting a huge sample of all the people who've contributed to that wastewater. Okay, so basically you're sampling entire communities or the communities served by a particular site, wastewater site. And so it's a very important early warning system. And for example, in Boston, it was very effective at picking up the earliest stages of the Omicron wave. And it started to go down before the caseload started to fall in Boston. So it is a valuable system, I think, for monitoring what's happening within the community, although not in a quantitative way. It's really just kind of telling you, okay, it's here, it's going up, or it's coming down. It's very hard to quantitate it and turn it into an actual proxy for caseloads. With that said, I do understand that Ed Desmond at the Department of Health Lab is in fact working on a wastewater system right now. So my hope is that it will become a part of our standard surveillance in the state very, very shortly. There were some early efforts, like you say, at the University of Hawaii, but I never heard much of the results out of that. So but I do believe that it's actually being incorporated into our system now, and they're in the process of trying to set it up right now.
If you had the opportunity to advise lawmakers right now, given where we're at and what recommendations you would provide regarding restrictions, doing away maybe with safe travels program or expanding that to include the booster shots. I mean, what would you recommend for lawmakers right now of where we're at as we see these restrictions begin to get lifted and some of the mechanisms that were put into place, talks of some of those things moving away as we move through the year?
Well, I think part of the challenge we've got is that our politicians are rather COVID averse right now. I think they're as tired of COVID as the public is. And so it's very difficult, I think, for them politically to come up and impose additional restrictions or to say that restrictions have to stay, because there is pressure from a very vocal group, basically, to lift those restrictions. With that said, my caution on restrictions is that we lift them cautiously and carefully. Okay, if we lift them too rapidly, we risk a resurgence of this virus, and we really want to avoid that because we don't want to drive the caseloads up again or put our community at risk again. I do think that preparing for the future means preparing the public to take the appropriate measures themselves that are necessary to control the epidemic moving forward. I think we're going to have a much more difficult time getting people or politicians and leaders to apply restrictions in the future. They're going to probably rely much more on people doing it. But that means we need to give the people the tools and the information they need to make those choices, which means we have to have high quality masks readily available for people. Rapid tests need to be readily available, and every household in Hawaii should basically be stockpiling some of them now while we're basically able to get them free from the government. Okay, and I think the government should continue to provide those moving forward. I think that making sure our treatment supplies are substantial and up to date, such that we can handle any surge that might come in the future, is really important. And right now, like I say, there's limited treatment, but more will become available in the future. We need to make sure that Hawaii has adequate supplies basically to treat our people should the need arise. Because especially for those who get breakthrough infections or those who are unvaccinated, those treatments may literally be the difference between life and death. And so I think we want to keep our deaths down. That's really critical. Now, on the boosters, I'm a strong advocate for keeping boosters or adding boosters to both safe travels and to safe access Oahu, as well as keeping them on Maui. I know the mayor on Maui is backing down on it now, but I would actually prefer to see the boosters kept there. I think keeping the boosters in serves several purposes. Okay, number one, with something like Omicron, the boosters, the problem with Omicron is your immunity wanes over time against infection. Okay, it still protects you, generally, your vaccine protects you against severe illness and death, but your vaccine gets less effective over time at protecting you against infection. And in fact, by the time you get out to about 6 months after your second dose, you're down to only about 10 to 20% protection against infection. It's almost, in terms of infection, as if you're unvaccinated. And if you get boosted, that goes back up to about 70%. Now let's think about safer access Oahu. The idea of that was for people to be vaccinated to reduce transmission, right? Because we're allowing people to go into places like restaurants without masks, where if they're infectious, they can transmit to other people within that room. So if people are not boosted and their protection is down to the 10, 20% level, which will be probably for most people, because most people got their vaccines in Hawaii prior to June. So if they're not boosted at this point, they don't have a whole lot of protection against infection with Omicron. Okay, so the potential for spread indoors becomes substantial. If they're boosted, that transmission is brought way back down again. Okay, so I think there are real advantages to something like safer access Oahu to having the booster in there. For safe travels, I think it also gets you similar benefits. First, it will keep people, when they are here, from getting infected with Omicron or with a future COVID variant and getting a severe case of it. The boosters bring the risk of, even with breakthrough infections, they bring the risk of severe illness down by a factor of 4, based on the studies that have been done in Israel at this point. So I think, the boosters are actually, I think it's a factor of 10 here in the US. 4 is for the 4th dose, which we're not doing here. But it's still about a factor of 10 reduction in the risk of severe illness. So that's really critical. And so we don't want tourists getting sick and ending up in our hospitals when we have such limited hospital capacity. The second benefit to having the tourists boosted is that they will be less likely to transmit on the planes or while traveling. And so we'll reduce the overall transmission in the country. And the third thing is getting people boosted is a major step in reducing the risk of even breakthrough infections. While the vaccines bring breakthrough infections down, we know with Omicron they still occur. And we can bring that down even lower with the booster. Okay, so boosters serve several important roles, and that's why I would tend to keep them in both of those programs, Safer Travels and in Safe Access Oahu and Safe Access Maui, or Safer Outdoors Maui.
I'm interested to know what you think when and Ryan kind of touched on this earlier, this whole idea of where we are now and where we're going, because there really does feel like and you had said this as well, once we're done with Omicron, we're kind of done with the pandemic, or at least there is this hope. And what I'm hearing from you is that is not the case at all. How much longer? And I know obviously you're not a fortune teller, you can't predict the future. But when you look at how other communities who have gone through Omicron and now, they're ahead of us because they got that first, where are they now? And what can that tell us about where we're going?
Well, the only place I would say that's really ahead of us in terms of Omicron at this point is South Africa. And they've leveled off at a higher level of infections than what they had pre-Omicron. They're not seeing, the deaths have started to come down, which, we are still in a rising death phase. So they're a little ahead in that regard. Their hospitalizations didn't rise as high as they did with the previous Delta variant. So I think, they've come out okay in that regard. So with Omicron, I think, the prognosis going forward is good. The problem is what comes after Omicron. I think that's the real concern. I remind you, July 4th of last year was COVID Independence Day. And we were touting that very, very loudly. The vaccines at that point basically were going to protect us. We had nothing to worry about, and the COVID pandemic was over. Okay. And then Delta hit, and all bets were off. Now we're past the Omicron, and people are saying the same thing again. Okay, the situation has changed. There's no risk. the pandemic is over. But again, I remind you, 35% of Americans are unvaccinated at this point. So there is still plenty of potential for spread of any new variant within the United States. And also, now that we've seen with Omicron, we can get significant immune escape with new variants. We don't know what the immune escape profile of the next variant will be. And it is possible that it may be able to break through our vaccines the same way that Omicron was in terms of infections. Now, we were lucky. Omicron did not break through our T cell, our memory T cell and B cell protections, which are kind of our long-term immune protections. And that kept us from seeing much serious illness and death associated with Omicron. But that may not be true with the next variant. If the next variant, in fact, goes back to being able to infect lung tissue more effectively, as the previous variants did, then we may be back in a situation more similar to the early ones, except with more vaccine breakthrough. Then we would have a problem. So again, I think anybody who predicts the future with COVID is exactly that. They're a fortune teller, and you should probably give them about as much credence as you give to fortune tellers, which in my case is not very much. And so I would be prepared for another variant. Remember, we are 24 months into this pandemic. It basically, the first reports were basically late December of 2019. We are 24 months later. We have had 5 variants that have risen to global domination. The original Wuhan, something called D614G, Alpha, Delta, and then Omicron. So once every 5 months, we basically have been seeing a new major variant that takes over the world. Okay, so I think it would be foolish at this point to assume we will not see another variant, at least within the next year, if not maybe 2 variants in that next year. And that concerns me because I don't know what the profile of that next variant will be. And honestly, I don't think we'll know until the variant comes along and we actually get some time to study it.
Is there any variant of concern right now that you can see that is popping up? And also, what happens to some of the other variants that have passed? Is there a case that Delta could resurge once again, or Omicron could come back, down the line? If you can speak to, the status of any other variants or existing ones that have gone through.
Yeah, right now the primary one that people are looking at is something called BA2, which is actually a version of Omicron. But it's about 30% more infectious than Omicron itself is. And so that is, for example, on its way to take, I think it's already 3/4 of the cases in Denmark. And Denmark is still on a straight up trajectory at this point. I mean, they slowed down for a little while, which I think was the transition between Omicron and BA2, but now they're on a straight up trajectory again. So we may in fact see that BA2 may slow our declines of Omicron if it starts to develop in large quantities in the United States. It's about 8% in the US right now, I think. So it is there and it is growing. But, whether it will get ahead and slow our declines of Omicron or not, we don't know yet. I think that's something that will play out over the next 2 to 3 weeks. But fortunately, it doesn't seem to be associated with any more severe illness or death. And so, they're not seeing substantial increases in mortality in Denmark, for example, as a result of this. Although hospitalizations are going up, but that I think is largely just the result of just a skyrocketing caseload. In terms of the other variants, there is the possibility that one of those other variants could come back. Once Omicron has kind of burned through, there are some concerns among immunologists that mild infections with Omicron may not give protection for very long in the unvaccinated. That they may only get 3 or 4 months of protection if they're not vaccinated before getting an Omicron infection that's mild. Okay. Now, for the vaccinated, it's less of a concern. In that, interestingly, the Omicron infection actually serves to strengthen the vaccine protections. What it actually does is it broadens your response. That is, you develop antibodies that can neutralize even more variants of COVID or more effectively neutralize the variants of COVID than you had before you got that infection. So the Omicron infection, just like the booster has exactly the same effect. It broadens your immune response so it works better against all variants that we know of at this point. Okay, so, I'm a little less worried in regards to the people who are vaccinated. I worry very much about those who are not vaccinated at this point, which is still 40% of the world.
We're at the top of the hour. It goes so fast, but I want to give you an opportunity to share a final thought. I know that, we had talked about sort of what you would advise politicians to do, and that would be definitely not to let your guard down. What are you telling just the folks who are watching today who are trying to navigate these decisions on their own? What do you tell folks about how they should proceed right now?
I think don't rely on the politicians to do it for you. They are obviously becoming somewhat COVID averse at this point, I think, for political reasons. We are in an election year, and nobody basically wants to be associated with COVID in an election year. And that means the choices to protect ourselves are really going to come down to what we do, what we choose to do. And for the politicians who are more averse to imposing restrictions and so on, can I suggest then that they turn their approach basically to providing people the means they need and the knowledge they need to protect themselves? Let's improve our public health messaging and put a good surveillance system in place, and then keep people informed of what it's showing them. Let's have the politicians prepare stockpiles of masks and rapid tests that we can deploy very rapidly to people should another surge come along. That will give people the means that they need to protect themselves against infection. Let's make sure we get adequate supplies of the treatments and put them in place, and that we streamline our medical system so that as soon as you test positive for COVID, if you are in one of those categories where your risk of a severe breakthrough infection or severe illness is high, then you can immediately get Paxlovid or the monoclonal antibodies that work. And not 5 days later, but the same day that you test positive. Let's streamline our system. Let's improve our overall systems and stockpile what people need to protect themselves, and then keep people informed so that they know when they need to take those measures. And I think the other factor I would say, everybody needs to take into account their own level of risk. For those of us who are older, those of us who may have coexisting conditions that put us at more risk of severe COVID illness, we need to be more cautious. And so we may want to continue using masks even if mask mandates get lifted, especially if we're in crowded or very heavily populated places. And so I think that people will need to take more responsibility, because I think you'll find the politicians more reluctant to take on a lot of responsibility at this point. And so it really will be in the people's hands. So let's help the people get what they need to protect themselves.
All right, Dr. Tim Brown, thank you so much once again for joining us this morning and sharing your thoughts and insights as we navigate through this pandemic together. Thank you so much. We really appreciate it.
My pleasure, as always.
Aloha.
Mahalo. Great to hear from him. And we see all of your kind words for him in the comments. We love having him on because he really does have the data and the knowledge to back up what he's saying. And really what he's saying is that we may be done with COVID. As we've heard before, it's not done with us. And so as we the numbers are relatively good today. I believe 833 cases reported. That makes us feel more reassured that the case counts are going down. Hospitalizations are stable. We are still seeing a lot of people dying from this disease, and he cautions that that is something that we need to watch. Also, that it's really important, if you haven't been boosted, to get that booster, because it does provide a lot more protection. And he's saying that we don't know, but there likely will be one, if not two, variants this year. Ryan, when he said that, that just my heart dropped.
He is being realistic of the past conditions and what has gotten us to this point with those 5 different types of variants. And he's saying what we could see moving forward. A lot of that, of course, would just be dependent on how things pan out. And it may be only way for us to tell how severe these other variants are is until it gets into a population where we can actually study it. He also talked about toward the end there, you heard his re-emphasis of what he believes needs to happen in order for us to be able to say that we are fully able to take on and battle this pandemic and this virus, saying that the state needs to build up its surveillance program, that it also needs to provide adequate treatment for those who test positive for COVID-19, as well as being able to provide masks and tests for those in our community at a higher efficiency and a higher availability to the general public in order for us to manage this moving forward if some of these restrictions that have been put in place and programs begin being lifted, which he, again, also is not in favor of.
Right. And we did hear that Maui Mayor Mike Victorino, who was the only politician so far, the only leader who had added that booster requirement to the Safer Outside program, which is their vaccine verification program in Maui County, has walked back and said that they're not going to require boosters. There's been talk of not only not adding that to safe travels, but perhaps scrapping that whole program altogether for visitors coming into the state. So a lot of back and forth on policy decisions now. Dr. Brown saying that those kinds of measures could be detrimental, especially if we have other variants on the way. So always great to hear from him. We're going to be talking to someone who's actually released a 10-point COVID plan, and that is Congressman Kai Kahele. He will be joining us right here on Wednesday.
Yeah, we're going to get an update from him about his thoughts on where we're at as a state with COVID-19. He's also been somebody that has been very active in Red Hill and the discussions happening there of what the Navy should be doing. And we'll hear from him about those matters, as well as any change in political political races that he may be eyeing. There's been talk in the community that he is looking at a potential run for governor. Of course, he is up for election in his congressional seat, and so he would ultimately have to give that seat up to take on the campaign of running for governor. So we hope to get an answer from him. We don't know that we will, but we will certainly ask that question on Wednesday. We hope that you are there for that conversation, and we thank you for being a part of our show here today. Until then, take care and aloha.
Aloha.
This episode of Spotlight Hawaii is brought to you by Longstrugs and Beachside Roofing.